we will start the afternoon session. I think I'd like to start this. We're finished with the chemical peel section in the effective use of cosmeceuticals in an aesthetic practice. And this is more of an overview talk, and then we're going to have presenters throughout the afternoon that are going to address the specifics about the different active ingredients and the benefits. But the first thing that I think it's important to think about is, as you develop your aesthetic practice, it's easy to get excited about new procedures. It's very easy to get enthralled with new commercial vendor offerings. And I always think that this is an interesting statistic, and that is that the aesthetically oriented consumer would like to change as their first area of concern, and 52% of them said that they wanted to change the texture of their skin. They want to improve the quality of their skin. And so, yes, everybody wants Botox. Yes, everybody likes and enjoys fillers, and there are, many other things that we can do. But in order to be successful, I think that we have to address their prime concern, and that really is the quality and the appearance of their skin. And the reason for that is that we psychologically gauge how old a person is and also how healthy they are by the quality and the appearance of their skin. So subconsciously, we're looking at skin, and whether or not it's registering at a conscious level, we're deciding how old we think someone is and also how healthy they are. And so it's something that has a very high societal value, and I don't think that in my basic medical school training that we really addressed very much about the health and the appearance of the skin. So the visible signs of skin aging are the skin becomes more dry in appearance, static and dynamic wrinkling, dyschromias, telangiectasias, loss of elasticity, and at a microscopic level, what we see is thinning of the epidermis, so epidermal flattening, atrophy, dysplasia, decreased eccrine glands, hyperplastic sebaceous glands as we enter the perimenopausal period, decreased terminal hair, decreased fibroblasts, and resulting decreased collagen, elastin, and glucosaminoglycans. So it's all very depressing. Skincare promotes healthy skin, and what I tell all of my patients is healthy skin is beautiful skin. The skin of an infant is velvety, seductive, almost irresistible in its appearance, and that is as healthy as your skin is ever going to be. My patients come in and say to me, well, doctor, I feel like I look healthier with a tan. I've never seen an infant that I thought would look better with a tan, okay? So the fact is we're trying to compensate for a decline in the appearance and the overall health of our skin. And for your practices, what it means is that we want to improve outcomes and prevent adverse events for virtually every aesthetic procedure that we offer. You saw this morning with the chemical peels that it's essential to prepare your patient's skin for any significant peeling, and the same can be said for all the different laser procedures and other interventions that we do. Intelligent prescribing for your patients helps them to avoid toxins, which Dr. Bitter is going to speak to later today. And cosmeceutical prescriptions for aesthetic patients is honestly appropriate and necessary. You can help your patients to make good selections for their skin type, for the skin quality that they have, and to improve the quality of their skin and to promote long-term health of their skin. And try to remember something that we all learned in medical school, and that is that the skin is the largest organ in the body. It's not just a container that contains our physical being. So medical skincare, the best results are achieved through both prescription skincare regimens and progressive office-based treatments. It's an ongoing process that requires proper assessment, treatment, follow-up in order to achieve the results that your patients will want from you. So who needs skin care? Everyone of every age and every skin type needs skin care for prevention or correction of skin conditions and maintenance of healthy skin.
Sometimes it's difficult to put amla cream on the lips because it's moving and dissolving. So the nerve block is easiest and very fast. We have 4 nerves, which is sensory nerve for the lips, 2 for upper and 2 for the lowers. The location of those nerves is coming from trigeminal nerve. The simplest way is if we take the iris of the eyes and go down one straight line, and the angle of the nose, which is just called wings nose, the wings of the nose, and go on a straight line, it will be somewhere in this point. So iris of the eyes, direct, and the wings of the nose, one line. So this cross point is where the nerve is entering out from the bone. The injection itself has to be deep to the bone around the interior of the nerve, either from outside, from the skin, or from the mouth inside from the mucosa. From the outside, what the benefit is very simple, easy to get it. But the problem, you will get prick of the injection, the mark, and risk of the bleeding a little bit higher. And the sensation is high, meaning the patient they will feel more pain. From inside the mucosa, the bleeding or the hematoma is almost zero. The pain is less. It's a little bit more difficult. And the patient usually they came scared, something from the mouth. But it's too much easier if you know how to exactly to enter it from inside. What we'll do now, we'll make it simple for the patient so she will not feel any pain during the local anesthesia injection. So what we're using first, this is dental block, which putting on the mucosa of the lips, which reducing the pain itself and giving some kind of anesthesia for the patient. So we'll be relaxed directly after that. Okay. Then we move the lips upward and just swap it on the area we'll inject, which is below the nose direct, both sides, up and down. It's mint flavor, nice, smell good. Okay, but they will got some kind of even the anesthesia of the lips, even of the throat. She cannot scream, she cannot talk, so it's good for you. Isn't it? This is my local, around 5 cc. We inject around 3 to 5 ml each area, 0.305 ml each area. What I'm using, this is the needle. I'm bending the needle around 30 to 45 degrees. So it's easier to manipulate with the patient. So we said we can go from outside, which is more painful, and from inside is easier. The area of the nerve is somewhere at this point, which is, if you put one finger at the nose wings, so directly you can go there. So this is the area of the nerve. But we'll do it from inside. So we take the nose line, this is the nose line,